Good afternoon. My name is Brandon Dreyer. I'll be presenting on VR therapy, as well as the evolution of VR therapy, different types of VR therapy, and how VR therapy works within the medical field. Let's begin with 1900s mental illness. First, we have Sigmund Freud's talk therapy. Then we have insulin coma therapy, where patients were forced into a low blood sugar state. Then we have metronidazole therapy, where patients were given seizures. Then we move on to more common things such as lobotomies, lithium, and the deinstitutionalization movement. Now, what is virtual reality exactly? Well, first, our senses form our worldview. So when we think of virtual reality, we're manipulating our senses to form a new reality. Beyond the headset, other gear is worn, such as controllers, to further immerse the person into this new reality. Most people think of VR headsets as just for video games, but it goes farther than that. So how does VR work? Well, there's a screen for each eye that covers 100 degrees, though 180 is more preferable. Each lens also has autofocus, otherwise the user can get nausea. And then each screen also runs at 60 frames per second, and there must be a 20 millisecond response between the user's actions and the screen to actually be able to trick the brain. Now, there are two types of VR experiences. We're going to have immersive, which is cave-like. It's better for exposure. It's your typical VR headset. And then you're going to have non-immersive, which is going to be like wearing earbuds and staring at a computer screen. It doesn't manipulate the senses as well as a VR headset does. In 1838, the first VR headset was made called the stereoscope, which used two twin mirrors to project a single image, which eventually developed into the Viewmaster in 1939. The Viewmaster then led to the Sensorama, created by Morton Heilig, who had a background in Hollywood motion picture, and then that led to the Telesphere mask. In continuation, we have Ivan Sutherland's The Ultimate Display, which was a head-mounted device that would serve as a window into the virtual world. And then we have the View system invented by NASA, Virtual Interface Environment Workstation, which used a head-mounted device with gloves. And then we have people like Jason Lanier who pushed for the development of virtual reality, and today we have things like the HTC Vive and the Oculus Rift. As we've previously established, VR can be used in health. It's used for diagnosing, treating, and provoking symptoms. Most of the time you see it as provoking symptoms, as you'll see here, PTSD or for depression, and often VR is in combination with talk therapy, which works in some scenarios. The Alzheimer's Society funded a 3-year research project led by Dr. Dennis Chan. The participants would wear an HTC Vive headset, then they'd proceed to follow an L-shaped path, and then trace their footsteps back to their starting point without any markers. This is said to prove better than any of the gold standard cognitive tests such as figure, recall, and symbol tests. At Emory University in Atlanta, they are using VR headsets to diagnose and treat veterans suffering from PTSD. Participants are shown a 2-minute clip of a simulated foreign military base and an American city while researchers monitor their heart rate and startle responses. They say that this is a better diagnostic tool because it's easier to create and control the scenario. Now, moving further with PTSD, they first used Vietnam War combat vets, threw them into simulated war zones, and then they moved on to Iraq and Afghan war vets, and in general they found that it reduced the PTSD symptoms that the veterans were having. With phobias, patients are placed into a 3-dimensional world. Between 6 to 12 sessions it takes to cure their phobia. The pros of this are that the environment is a lot better to control. Say with spiders, it's a lot easier to control the spiders within the environment than to control spiders in the real world, and they can also set the situation up instead of having to travel to a location. People with eating disorders are characterized by pathological eating habits and a tendency to overestimate their body weight and shape. Virtual reality allows an escape from that, as it exposes them to high-calorie foods or changes in body shape to help them feel better about themselves, and also their food reactions. At the University of Houston, they're using virtual reality to treat things such as cigarettes, heroin, and alcohol. To do so, they place them in a simulated environment based on what their misuse is, such as using a bar for alcoholics and a person's house for heroin. Virtual reality and physical therapy helps with rehabilitation, as patients can be distracted from the pain by being placed into a fantasy world. They also use the headsets to train cognitive abilities, and they put them on something such as what I have here in the pictures to do some physical exercise. They can measure the goals of the patients and provide real-time data to keep them motivated. In the past, they would use electroconvulsive therapy, which was a slight shocking of the brain, to help increase serotonin levels. Well, they found if you wore a VR headset and watched something happy, then your serotonin levels would further increase. Now, they recommend doing it 20 minutes a day to help combat depression. There are some issues with VR, and a big one is going to be the research. Not enough research has been performed, but so far research that has been performed has been 100% in favor of virtual reality. But there is limited content right now, so as that comes out, maybe things will improve. Now, also with wearing the headset, you can adapt nausea and motion sickness. On the other hand, there are pros to virtual reality, a big one being confidentiality, as a patient only has to sit in a room instead of being within the public eye. It is also cheaper, as they do not have to travel or make any kind of purchase besides the VR headset. And lastly, the two are control and predictability, as a simulated environment is easier to control and predict than the real world is. Honestly, it is probably easier to go see a therapist and use VR therapy than it is to purchase your own. As you see here, I've listed two of the big VR headsets, the Oculus Rift and the HTC Vive. They're pretty expensive. In addition to that, to even use them, you need to have a computer worth at least $1,000. That's if you wanted to own one at home.